Good morning, everybody, and welcome to the campus COVID-19 briefing. Please note that live captioning and ASL translation are available and that the recording will be posted later today on my website. When we post the recordings now, we include timestamps that go to each topic or question that was addressed, making it easier for everyone to find the information that they're most interested in. Today we'll be going till around 11 a.m. and we'll get to as many questions as we can. And you could ask questions, of course, as always, using the Q&A function. We're joined today by Provost Susan Collins, Vice President for Student Life, Martino Harman, U of M Chief Health Officer and Physician, Dr. Preeti Malani, Dr. Rob Ernst, a physician who leads our Campus Health Response Committee and is an Associate Vice President of Student Life, Emily Martin, an Associate Professor of Epidemiology in our School of Public Health and a member of our Campus Health Response Committee, Judith Pennywell, Director of our International Center, Patrick Morgan, Chief International Safety Officer, and our ASL translators are Laura Clark and Carmen Johnson. First, I'd like to begin by bringing in Drs. Ernst, Malani, and Martin to discuss what we're seeing on campus and around the state and the work of the CHRC now. Can you give us a summary of the latest campus conditions around COVID-19?
Well, yeah, over the last couple of weeks, we have seen an increase in COVID activity on campus. A couple of things that we've learned about COVID is that conditions change when you have mixing of populations or movements of people around. That's why I think early on in the semester around move-in, we saw a quick increase and then sort of stabilization period. Then we had 6 weeks of pretty steady low-level activity. That was through the latter part of September and much of October. The first week of November, we saw a sharp increase, primarily among students, and that was maintained this week to a somewhat lesser degree. The triggers that we've seen had been movement around the fall break with some travel, as well as large off-campus social activities. I think when particularly those social activities open up to the population outside the student community, which is highly vaccinated, that's where we've had some problems with students and exposures to others. I would say that we haven't seen has been transmission in the residence halls, and that's also been substantiated by our wastewater surveillance that has not shown a lot of activity, very minimal within the residence hall community, or we haven't seen transmission through the classrooms. We have seen a sort of nudging up of the activity amongst the employees. Those exposures have been some social contacts, but also household contacts where they've seen impact of unvaccinated folks in their households. So we're going to maintain our approach. Our containment teams have been keeping up. We still have very reasonable space in the quarantine and isolation, but we're hopeful that we can manage this through the upcoming travel season as well. So you'll hear more about that.
So those couple of clusters, Rob, that we mentioned in the recent updates online, those are contained now?
The earlier one that seemed to be mapped to the fall travel or the fall break period seemed like it was not spreading throughout the campus afterwards. The impact of the Halloween weekend, I think we're still seeing connections to these there were a couple of very large parties that were arranged at the off-campus bar areas. I think bars are particularly problematic because that's where you get individuals from the community mixing with our highly vaccinated population, and that's a risk area, particularly as the activity in the state and the surrounding community is getting a little worse.
Yep, and it's notable that our student population is now 98% vaccinated, something I'm just enormously proud of. And I think that's, why we're able to see cases, but not big spreads. Preeti, did you have anything to add about what's going on campus? Yeah.
I'm just reflecting on Rob's comments and thank you, Rob, to you and the team for just keeping track of this. And, Rob, one of the things that I think about is us and like the fact that we've developed our own language. You and I, like siblings might have, or coworkers. And one of the things that you and I have said a lot since last year was 90 days until Thanksgiving. And although this year is really night and day, I think that expression applies. And I just can't say it enough. You know, the pandemic's not over, but we have tools to keep us safe. And vaccines are at the top of the list. You just heard our campus is incredible. 98% of the students are fully vaccinated. And, you know, when we see COVID, it's not spreading in classrooms and study spaces when walking past one another. It's parties, it's huge parties, it's indoor parties. And thankfully, most people aren't ill, but we are worried, especially as Thanksgiving, that 90 days till Thanksgiving is coming up. But I want to say too, you know, just wearing my mom hat, you know, it's really disruptive to get COVID. It's disruptive to have to miss class, to not be able to study if you don't feel well. And, you know, flu, we're going to talk about flu in a moment, but this is something we see every year, and there's no exception this year. So if you haven't done so, get vaccinated, not just to COVID, but to flu. And I think as Dr. Ernst said, you know, we're facing a surge in particularly the west part of the state. And Rob, for the record, 13 days till Thanksgiving.
That's great. And, you know, you mentioned flu. We're seeing an increase in flu, of course. Can you tell us what you're seeing through the health service and what our community members should be doing to stay healthy from this, you know, every year influenza cycle?
Yeah, and the time frame's about the same. Over the last 2 weeks, we've seen almost 500 documented cases of influenza. We're doing a lot more testing for influenza than we have done historically. I think that's the impact of COVID, where, you know, our PCR analyzers give us the ability to test for other respiratory pathogens as well. So, you know, this past week, we were seeing for students presenting with suggestive symptoms, and the overlap for the presentation between COVID and influenza can be very similar. In this past week at the health service, about 30% of those folks were having influenza, and, you know, more like 5 to 6% with COVID. You know, that's and the difference in demographics is worth mentioning also. Whereas COVID is spreading primarily, almost entirely off campus, the impact of influenza has affected all students. So we're seeing it in students living in residence halls as well as off campus. I would remind folks, just as Preeti said, there are some things we can do to help prevent spread of influenza. One is to get a flu shot, and we're trying to encourage students to either through their usual healthcare providers, the health service, or we're standing up some additional flu shot clinics, or when they're home, you know, get a flu shot when they're home, and encourage their families to get flu shots. The second is that it's been shown for some time that masks are very effective at preventing transmission of influenza. So when you're indoors and around other people, you know, that is a further encouragement to wear masks, particularly if you don't know who those, you know, if they're not part of your social bubble. And more than anything else, if you're not feeling well, you know, isolate yourself and get evaluated. I mean, I think that we're continually disappointed when we hear about, you know, these, you know, outbreaks that happen, and they will map back to people who were symptomatic and then continue to socialize. You know, so I think that's tough, but we really need people to just, you know, have some self-awareness. If you're feeling symptomatic, separate yourself and get evaluated.
Yep. And, you know, in the vernacular, we say flu shot, but flu shot's a vaccine, just like the COVID vaccine's a vaccine, just to, you know, make sure everyone's together. Professor Martin, what are we seeing at the state level in terms of COVID and flu?
Sure. Well, I brought some numbers. So these are numbers I'm pulling off of my startmap.info, which is a collaboration between the state and the university and daily tracking of our case rates. And what you see is, you know, throughout the fall, things had sort of started to stabilize and maybe creep down a little bit in the state, but now statewide, we are definitely seeing a jump in cases overall. Those lines on the graph of the different colors, those are the CDC risk levels. When we get above red, that's when the CDC says to wear masks indoors. And so you see, we are well in the range where CDC is saying case rates are high enough that we need to be wearing masks indoors. So the next slide, I also brought some Washtenaw County specific numbers. And if you see here, we were actually really kind of heavy into our decline at the county level mid-fall, but the county is also experiencing quite fast increase. I did want to note that if you compare our county to counties elsewhere in the state, we are very low compared to other counties around the state. And Southeast Michigan is lower than other areas of the state, but as our students start to get ready to move around for Thanksgiving break, be mindful that a lot of areas of the state are experiencing, in some places, twice as high the rate that we're experiencing here in Washtenaw County. So things are definitely heating up around, we're hearing reports from other areas of the state of medical systems feeling the pressure. So we're having increases here, not nearly the increases we're seeing elsewhere. And I think everybody should be kind of mindful of that next week.
Thank you. A couple of questions actually that came in recently for the group. I guess this first one is really for Dr. Martin, but others can chime in as well, of course. Do you believe that the in-person football games are increasing the number of COVID cases in Southeast Michigan or more widely?
Yeah, so this is a really complex question because football games, it's rare that somebody, well, me, I go to the football game and then go straight back home, but most people do not. And so, we have seen, especially in the last weekend, a lot of activity around some of these other big gatherings that were happening about the same time. Early in the season, there was a lot of work with the health department sort of looking for cases that could be tied to the football game, nowhere else, and didn't find a smoking gun there, didn't really find any obvious patterns. But there is no question that a lot of the other activities of our last football weekend, we've definitely seen cases tied to that. We still maintain that indoor is more risky than outdoor. So great that football games are outdoor, and we still know that masks help in both of those settings. I think, my mind is as a fan is turned to basketball, and I was so thrilled to see the Maze masks on students in the basketball game this week. And so a big shout out to that. And so there are still things that we can do even in those settings to make them more mitigated.
Any thoughts on that, either Rob or Preeti? Football?
I would just say, the before and after is, in my mind, the concern. And I think Dr. Martin touched on that. It's again, not zero risk. And I think the bigger, the more indoors. And, as we've a few weekends left of football, and including some big weekends coming up. So be careful.
Yep. I guess, Rob, what's our latest thinking on the indoor mask requirement? Are we sticking with it? Yeah, we'll be masking for the indefinite future. How does the CHRC and our experts look at masking right now?
Yeah, and Dr. Martin just alluded to that a little bit with the Michigan Health Department graphic there, where the factors for determining, risk threshold in these indoor spaces where transmission is easier are degree of vaccination and the extent of infectious prevalence around us in the community. So the fact that we have a very highly vaccinated community is encouraging. The problem right now is the disease activity around us. So there's not a chance that we're going to start next semester, with changes in this position, but we'll continue to evaluate it as the conditions, change. And if we get down below substantial levels of COVID in the community, those would be a minimum necessary for consideration.
Yep, thank you. Thanks, Rob and Preeti and Emily. I'm going to hand things over to Preeti now to speak with the Provost on some questions that have come forward on campus.
Yeah, thank you. And so Provost Collins, it's been a busy semester. We're looking ahead, it's hard to believe, but again, that 90 days till Thanksgiving that Rob and I, always talk about, it's like our rally cry. What can faculty and students expect in the classroom in terms of learning for winter term? And really, are there going to be any major changes in how things operate compared to the fall?
Great. So first of all, good morning. Good morning, Preeti, and good morning to everybody. And yeah, it is November 12th, and it seems like fall has gone quite quickly in a lot of different ways. and we're very close to Thanksgiving. So before I get to the questions, which I'll do in a moment, I would just like to congratulate our students for increasing voter turnout by 18 percentage points in the 2020 election. And of course, that was during a time when across our country, COVID-19 cases were growing really quickly. And this was a kind of concerted initiative that I think it's worth taking just a moment to step back and to be proud of. So Michigan's student turnout far outpaced both the overall voting population and the nationwide average for college campuses. And several of our faculty and staff collaborated with student volunteers from across our schools and colleges to increase turnout and adjust the realities of how the pandemic was playing out in our context, so as to really encourage voting. And this included providing information on just a multitude of voter registration laws, because of course people weren't always in the location that they would expect to be voting on, and deadlines, and sharing that information with our students, how to vote by mail, and also the important historical context about people in our nation who have not always had the right to vote. And so that really holistic approach was just commendable in a lot of different ways. The collaborations resulted in the Ann Arbor City Clerk's first ever satellite office on a college campus, and that was inside UMA, the University of Michigan Museum of Art. And the Stamps School of Art and Design faculty, Stephanie Rowden and Hannah Smotrick, worked in partnership with Edie Goldenberg of the Ford School of Public Policy, as well as staff from UMA, our government relations office, and the city to design, open, and manage that office. And that project resulted in registration of over 5,400 voters and collecting 8,501 ballots. So just a really impressive initiative to increase turnout and also information about voting and why it's important. So plans are already underway for 2022, and they include another collaboration with the museum for a satellite office, as well as a new pop-up office that would be on North Campus in the Duderstadt Gallery. So I just wanted to take a moment to say congratulations, especially to our students, but to all the faculty and staff who collaborated in what really was just a wonderful outcome. So why don't I shift to the first question, which of course is about classes, teaching and learning for winter term. And yes, we do expect the winter to look a lot like the fall, with some more of our courses taught in person, especially for our graduate and professional students. There were more of those courses that were taught remotely in the fall semester. So as we've discussed today and many of the previous briefings, our classrooms, all of the information that we're gathering, and of course we'll continue to monitor and to look carefully at all of the indicators that we follow, our classrooms remain very safe and we're not aware of any transmission in those contexts. So our collective efforts, as others have already said, the very high vaccination rates, the masking indoors, the highly effective ventilation systems that we have in our classrooms across campus have all worked together to help keep our in-person teaching and learning safe. And we just heard from so many students and so many faculty as well about their appreciation for being able to engage with one another in person as part of courses. Of course, it's not 100% back to the way things used to be, but the ability to engage in person has really been important for so many. And so I'd also like to just thank everybody for all of the work that's taken to be able to enable us to manage that. Registration for winter 2022 semester begins on Monday, November 15th for our graduate programs, and on November 18th, next Thursday, for our undergraduate programs. And as always, I just want to remind our students to engage with their advisors as you are determining which classes to take for next semester. So kind of a lengthy answer, but really important as we're looking forward to the next semester and all of our courses.
Yeah, I wanted to insert one thing. That's why I popped back on. It's showing up in the Q&A. Last year at this time was such a traumatic period, and people recall, of course, that we told you not to come back after Thanksgiving. We went fully remote again. That is not being contemplated now really at all. So although caution is important, the data that Rob and Preeti spoke about and Provost Collins's observations about our dorms not having transmission other than sporadic cases and our classrooms being safe, there's no plan about changing at Thanksgiving time. So we'll be, sharing more info moving forward, but please don't, let last year's trauma concern you that this year, all of a sudden there'll be an announcement. I just wanted to interject that. Yep.
Thanks.
Yeah, and I'll just follow up. Yeah, this is completely different than last year. And again, it's safe, effective vaccines, and there are going to be bumps, and there'll probably be bumps in the winter also. And I just wanted to say thank you to the faculty, because I know they've not only been, really dealing with things outside of work. A lot of them have, young kids whose lives have been disrupted, but they've also been really accommodating for the students who've had to end up being isolated, who've had either flu or COVID. And I think the in-person learning has just been so valuable. I mean, I hear the students talk about how, their favorite time of the week is, that discussion class on, something that maybe be completely out of their major. And also for people who don't know, Provost Collins, is our former dean of the Ford School of Public Policy. So the voting is very near to her heart. So congratulations on that.
Yeah. Just to follow up with one point that you made, Preeti. So absolutely want to reiterate the appreciation for all of the just work and flexibility that our faculty are doing, but also for our staff. We would not be able to be in person and to be engaging with our students and with our research programs and all of the things that are mission critical without the really thoughtful, creative, and just hard work of our staff as well as our faculty. And so I just wanted to make sure to mention that as well.
Yep, thank you. As they say, you make M go. So thank you to our staff. Speaking of finals, as finals get closer, the tents are going away, and it is actually starting to cool down a little bit. What options do students have for study spaces? I know last year it was very limited, but there were some creative spaces.
Yeah.
How does this look right now?
Yeah, and actually, so we are in mid-November, but it has been so mild. But yeah, the temperatures are starting to go down. And so that is a really important question. One very positive development that came out from the work that we all did together last year was developing a central resource to identify study spaces. And so if you go to studyspaces.umich.edu, you will find information that means you don't have to go facility by facility, which used to be a very time-consuming and inefficient way to try to figure out what was available, when the hours were, and all that. So we actually worked with students to make sure that we had that resource available. There are, and that enables those spaces that require reservations, kind of a one-stop shopping to be able to go and to do that. But there are also spaces on campus that don't require reservations. And let me just say a bit about some of those. The Michigan Union is open until 2 a.m. daily. The League now opens at 7 a.m. daily and remains open till 11 p.m. on weeknights and till midnight on weekends. Pierpont Commons is also open until 11 p.m. daily. We've expanded some of the library hours. So Hatcher is now open on Saturdays from 10 a.m. to 6 p.m. And both Hatcher and Shapiro open at 8 a.m. Shapiro remains open until midnight, Sunday through Thursday. So those are some of the extensions. Rackham also has spaces available for students who want to participate in a Zoom or online meeting or classes while they're on campus. And so that's a resource that I wanted to make sure people were aware of as well. And as we get closer to the exam period, to finals, some buildings will offer even more expanded hours then, and that information can be found on their websites. But one that I just wanted to call out is that during the December study days, Shapiro will be open 24/7. And so just wanted to make sure that the students were aware of that one in particular.
It reminds me of the old days of, the all-nighters at the undergraduate library. At the time, we just known as the ugly, but Shapiro's a much better name, and it is no longer ugly. It used to be ugly.
It's not ugly, no.
It's not. Thank you so much, Provost Collins.
My pleasure.
Thanks, Susan. We now invite in Vice President Martino Harman from Student Life. Martino, welcome.
Good morning. Good morning. Welcome. Good to see you, Dr. Malani. Good to see you, President Schlissel.
It's really good to see you, Martino. I know there's some questions that we have. They're teeing them up right now. So, boy, it's been a good semester overall for the students. And we've talked in the past about how we really have two entering classes. We have some students who really literally never spent any time on campus, and including even our junior students who, were sort of getting the hang of it and were removed, had to go home. How can students get more engaged in learning experiences outside the class? People got the classroom stuff down, but, in terms of making Michigan their own.
Preeti, I tell students all the time that I'm much like a second-year student. My first year here on campus, there weren't opportunities to really get engaged at all in a normal way. And so now I'm out and about, just like those second-year students discovering the University of Michigan. And we have many opportunities to be engaged all semester long, but our data really shows that there's a lot of interest in educational experiences as we get back to sort of life as usual. And just for an example, our division facilitated over 7,500 unique educational experiences in 1 month. So that's quite a bit. So students are definitely interested in that. And I don't mean in the classroom educational experiences, I mean co-curricular outside of the classrooms. We've seen a lot of interest in civic engagement. As Provost Collins talked about the voting participation last year, students are really interested in that, but also leadership development opportunities in particular. And just a couple of quick examples, there are many layers to supporting students in this work, but the Ginsberg Center Pathways to Civic Engagement is one really big avenue for students to make connections in this way. And also IGR's intergroup dialogues, which provide spaces for students to learn and practice respectful dialogue on often divisive topics. And the MLEAD program offers numerous ways that students can develop competencies and leadership for social change. And that's just a sample of the amazing work that's happening in the ways that students are getting involved in learning and leadership opportunities.
Yeah, that's all great news. And I do recall that we talked to you as like a new student. So it's good. And like you're adjusting and getting involved in things too. So, and again, to students, these are great opportunities, really like it takes a while to find your people and, keep at it. And if it didn't happen this semester, winter semester, really take the time to get engaged. So this is a good question. What resources are available to help students adjust to recent time change? And I think what that means is not just that you're perpetually an hour falling back, but the fact is it gets darker earlier. And then the decreasing temperatures, and particularly for some of our out-of-state students, this is maybe something they haven't experienced.
It's a real adjustment to the time change. And, I'm used to the cold, but the lacking sunlight is a little bit challenging. As a matter of fact, I have probably too much sun coming in my window right now because I'm just looking for sun. So, but adjusting to that time change and shift from more sunny days to cold weather can be a real challenge. So we encourage students to take advantage of well-being resources by going to the Student Life Wellbeing website. And there's a host of different options of events, offices, programs that most appeal to the needs that students have around well-being. And many students are already taking advantage of these offerings. Another data point, just in 1 month, Student Life has facilitated over 110,000 well-being related interactions with students, ranging from fitness classes to appointments with Wolverine Wellness and CAPS to well-being focused programs through Fraternity Sorority Life, through the Center of Campus Involvement, the International Center, and on and on. That 110,000, that's enough to fill the big house. So that's a pretty big number. In October, though, this is really exciting. We reopened the Wellness Zone on the 4th floor of the Michigan Union, and that was created with input from students. So it features a bigger renovated area that's now open for all the throughout all the building hours, not just connected to CAPS hours, but when the building is open. And there are wellness zones in Pierpont Commons and the Munger Graduate Residence Hall. And these areas feature massage chairs, light therapy, and that's particularly great for those struggling with less sunlight, and meditation tools, yoga mats, games, and more. So, you know, during these times, it's important for us to really focus on our well-being and look for those resources, and they're out there. So I just encourage students to find them and take advantage of them.
Yeah, and I just like to add, every day find a way to get outside, and it is still mild. I hate to tell people, but it's going to get a lot colder in the coming weeks, and I think particularly January, although it's very pretty with the snow. So just try to embrace it, and it's part of your experience here. And I love the wellness zones. I'm glad to hear that they're back open, because that's been between the union being renovated and now with COVID, the closure. So check it out. Will there be any changes to the requirements for students planning to live in residence halls for the winter semester? And last year there was a big change between the fall and winter. This year, not so much.
Right, and I'll answer that. But before I do, Preeti, on the topic of wellness, I want to ask you to give your wonderful dog Sully an extra hug for me. So I just thought about Sully when I thought about wellness. People love wellness pets and dogs, so I just thought about Sully. So
Sully made a trip to the CSTP, but it was not completely successful. He's no therapy dog, but he does love to visit everyone on campus. So
great. So to answer your question, obviously safety and well-being are top of mind as always, and they always will be. And the policies that are in place for housing now will continue next term. The great news is that in housing, 99% of the students that live in housing are fully vaccinated, and the other percentages would be students that have an approved exemption. So those in residence halls for winter 2022 with approved exemptions will continue to be required to participate in mandatory weekly testing. And as we head toward the end of this semester, make sure that if you're required to participate in mandatory testing, that you do so, that you avoid the emails and the calls and the reminders from staff in housing. Make sure that you participate. And we encourage all students to be vaccinated or unvaccinated to test before they travel for Thanksgiving break. It's really good just to know your status before, and that we can keep your families at home healthy. If you're a student and your account is on hold and you can't register because you haven't met your mandatory weekly testing requirement, it's obviously important that you take care of that as soon as possible so that you can get on with your university business. And this helps ensure that we have a smooth transition to winter term, and we can focus on courses and community building activities for peers. And Preeti, if I can sneak one plug in for the blood battle, I want to encourage everyone, students, faculty, and staff, to consider donating blood to this year's blood battle versus Ohio State. We have until November 24th. That's a few days before the big game. And there are locations all across campus to make it easy to donate. And you can walk in, but it's really preferable if you make an appointment. So you can make an appointment at bloodbattle.org. That's bloodbattle.org. And besides the bragging rights that we will get, this is really helping others when you make that donation. And you can also get a t-shirt and a coupon for Washtenaw Dairy. Even though it's cold, Washtenaw Dairy is still great. And raffle entries as well. So I need to do that myself. So I just wanted to get that plug in before we move on.
Well, that was the real deal maker for me, Martino, a coupon for free ice cream.
They have donuts too. They have donuts and coffee.
I have an appointment this afternoon to donate blood, and I really do encourage everybody. And we're always looking for things that we can do that are simple to help others. And giving blood is giving life. So I think it's a really important and lovely gesture you can make to people you'll never get to meet, but you can still help. So thanks for mentioning that. And thanks, Martino, for the comments and all your hard work. And I think we're going to invite back now Dr. Martin, and I'll ask her and Dr. Preeti, Dr. Malani, to discuss travel in general. What are the safe ways to travel, and what's the testing options around traveling, and just what advice you have for our community as we approach the holiday.
Excellent. I can start out, and Preeti, you can tell me what you can kind of add on to that. So, first I wanted to start by mentioning CDC has great, really detailed recommendations on travel. For unvaccinated people, the recommendation is to limit travel. For vaccinated people, the recommendation is to add testing around travel wherever possible. So we have tons of testing options available to our community, both our U of M community and our broader Ann Arbor community. So bring your families to some of these events. For unvaccinated students, staff, and faculty, if you do choose to travel, we are recommending 2 tests in the week before you go travel. But the testing options are available to our vaccinated people as well. There's tons of capacity. So the CSTP sites are open to all U of M students, staff, and faculty. I've put the links here for registration, and to schedule your test is on the Campus Mason Blueprint. If you come to the new building at North University Court, the old dance building next to CCRB, you may just be able to spend time with Hawkeye, the wellness dog. So plenty of space. Please come on down and get tested between now and Thanksgiving. For those of us, especially for people that have got family members or other that are not U of M affiliates that like to get testing as well, we've got community rapid testing in partnership with the county and the state. We've brought that resource in. It's going to be in the W16 parking lot across from Munger over by South Quad, in that triangle shaped parking lot. Plenty of capacity there. This QR code here will help you sign up to get a test. And that one, you bring your kids, bring your spouse, anybody can come to that. So just a resource we're able to make widely available to the community.
I don't have much to add, except that, the safest thing from a COVID standpoint would be to, never gather. And that's certainly not a good thing for our overall well-being. And I know my family wasn't able to really gather in a traditional way last year with things surging and with, just being so complicated. And I hope everyone has a really safe holiday and that they're able to, with their friends or their family gather. And testing is one more layer beyond vaccination that helps keep all of us safe. And thank you, Emily, for all the work with CSTP. And the pop-up is so great. The pop-up service is going to be great.
Yeah, we're really excited to have that resource available.
Thanks, Emily. Many in our community will be traveling internationally as well. And here to discuss tips and university resources are Judith Pennywell and Patrick Morgan. Judith is the director of our International Center, and Patrick is our Chief International Safety Officer. If you recall, the effects of COVID-19 manifested overseas before they reached the United States in the early months of 2020, well before we had our first case here in Michigan. Judith, Patrick, and their colleagues were amongst the first on our campus to spring into action, supporting our students studying abroad and international students who were studying on our campus. So a big thank you to both Judith and Patrick for those efforts that now seem long ago. And thanks for joining us this morning. I'll turn things back to Preeti as Judith and Patrick deal with some questions that have come in about how to keep safety in mind for international travel.
Yeah, thank you. And I think my very first phone call in January of 2020 was to Patrick. And I think I've, talked to Judith like every day, for months and months. So I think people don't always see them certainly in this setting, but they've been at it every single day, trying to really figure out not just, getting students here, getting them back and forth, connecting with them, but also thinking about the future of international travel. So, Patrick, can you just talk a little bit about, some things to keep in mind for international travel? And of course, some people are doing it over Thanksgiving and many more are going to be doing it over the winter holidays. Some quick tips from you.
Sure thing. And thanks for having me. And you give me less than fond memories of January 20th when I look back and saw that my very first email to you about the novel coronavirus in Wuhan causing respiratory issues was January 20th,
Yes,
2020. So it was quite a long time and a big journey since. But thankfully, there's been a lot of good news concerning travel abroad since. And where we are right now, more countries have opened their borders to tourists, business travelers, and students. And more opportunities such as study abroad and internships are available for students on University of Michigan related travel. I saw in the chat somebody mentioned, our study abroad programs completely open yet, and they're not completely open. This is a phased process where as the situation improves in countries, we evaluate the programs one by one, and then would approve those that meet our specific requirements. So we're getting there. We're not full steam, but winter 2022 is going to look a lot better than the previous terms that we've had. And so with all that said, and all the positives are great for our faculty and staff conducting research around the world, we're not quite out of the woods yet. And so I'm just here to remind us of some of the challenges that remain, which continue to evolve. And traveling during the pandemic has posed health risks and additional logistical risks, and it requires careful preparation and flexibility to adjust plans as conditions change. And the two key areas I'm going to focus on are entry requirements to other countries and U of M requirements for international travel. And sticking with the entry requirements, we need to remember not every country is open to travel, and many open countries have requirements very specific to COVID-19. And unfortunately, these requirements can change often and at any time. So my advice is that travelers stay up to date on verifying their ability to enter their destination country before making any non-refundable purchases, and then check again before flying out to make sure that nothing changed and that their checkboxes are all complete and they meet all those requirements. This can understandably be a frustrating process to determine exactly what is needed, which often involves having proof of vaccination that host country needs, completing any forms online or health portals required by that government, and having the type of negative COVID-19 test that country requires. So without having everything in order, the host country simply will not let that person enter the country. And to make it easier for you, we have put FAQs on the Campus Blueprint site and also on Global Michigan. And we'll be sharing a resource slide with you when this talk is over, and post it on the Campus COVID-19 Briefings website so that you have easy access to links and resources. Secondly, with U of M policies, the University of Michigan provides information on which countries undergraduate and graduate students can consider for U of M related travel, such as research, fieldwork, study abroad, athletics, and the many other areas. Currently, undergraduate students are eligible to travel to 120 countries if they meet the host country's requirements and U of M's requirements. And U of M requirements are found on country-specific web pages on Global Michigan. So for example, if you wanted to go to Ghana, you go to the Global Michigan Ghana page, and you'll see that it's a COVID-19 medium risk designation, which means it is open to undergraduate student travel. And you can see the requirements right on that page so you know what to do. Now, graduate students and faculty and staff are eligible to travel to any country as long as they meet U of M's requirements and again, meet the host country's requirements. So these requirements, the basic ones are register in our M-Compass travel registry system, which you can access through Global Michigan or through Wolverine Access. And this is how we contact you in the event of an emergency. We also have the travel abroad health insurance called GeoBlue, which also includes political and natural disaster evacuation coverage. And so if you're registered for travel and you have this insurance, if something happens to you like an earthquake, we can get in touch with you and see how we can extract you. And also because we are in high risk travel period right now, students will need to complete a travel plan, such as a COVID-19 travel plan for travel to countries with elevated COVID risks like Ghana that I mentioned, or a safety plan for countries with elevated safety and security risks in addition to COVID risks. Again, details are on Global Michigan, and so it's there to see and for you to view. To recap, I think it's wonderful that travel has been restored and opportunities have increased, and though challenges remain, they are not insurmountable with just a healthy dose of planning, flexibility, and some of that glow blue determination that our Wolverines have. And so with that, I'll give it over to Judith to talk about the international students.
I think just a quick summarize, it's basically a lot of people who are asking me about travel. Part of it is just how necessary the travel is. Again, for people whose homes are elsewhere or like their research is critical and it's ongoing. But, if people are like, it's a leisure trip, might want to wait.
You're absolutely right. And even during our suspension of non-essential travel, we were one of the few institutions that still did have faculty research going abroad that was critical and necessary for the mission of our university, and graduate student travel still work that was also necessary. So it's been a road bump, but we've worked through it to meet the mission.
Yeah, it seemed impossible a year ago to even have this moment. So thank you, Patrick, for all that you've been doing. And Judith, on the other end, and speaking of sort of, required travel, many students in our community are going to be returning to the U.S. They'll potentially go to their home country, visit with family, and return. Can you talk about what that will look like?
Yes. So some international students, faculty, staff, and employees They might consider traveling for personal reasons in the next few weeks and months. And so I wanted to start really by offering the standard reminder, the friendly reminder from the International Center to please check your passport to make sure it will remain unexpired for at least 6 months beyond the date of your return to the US, and to be sure that your visa stamp is unexpired and has multiple entries remaining. Specifically for students or scholars with I-20s or DS-2019 forms, they need to make sure that they have a travel signature from the International Center that will be no more than a year old when they re-enter the US. Recently, we've been able to offer F1 students electronic I-20s. So this is a new thing. So we want to make sure those with electronic I-20s get a travel signature and print the I-20 form before traveling, and that they keep a hard copy of it with them to present to the port of entry officer when they return to the US. Our international population also must be mindful that US consulates and embassies abroad, they may not be operating at full capacity yet, and they may close or cancel or reduce appointments due to adverse local conditions like COVID outbreaks. So that is something to really think about in terms of traveling if you need to get a visa renewed while you're abroad. Now, while there's no longer country-based travel restrictions in place, those entering the US must be fully vaccinated, as we've discussed before, with an FDA or WHO approved vaccine and proof of negative COVID test. The CDC has named a few countries whose citizens are allowed to travel to the US without an approved vaccination. And a link to that list can be found on the IC website and then the websites that we'll share out with today's recording. While all the additional steps are important for traveling overseas and returning safely because of the pandemic, we really encourage anyone thinking about traveling to take care of these details well in advance. And that includes getting travel. You need to do so, and do that as soon as possible. It's important to note that you may face unplanned disruptions should you decide to travel abroad, which make your return to the US more difficult, unfortunately. And then the final advice I always like to share is check out our website. We will announce any changes that we learn from the CDC or Border Patrol on our webpage that's pertinent to the international populations we serve. And we also will share travel reminders and updates through that source. So definitely refer back to the International Center website should you decide to travel.
Yeah, thank you so much for all that you do, not just around COVID, but really supporting students so broadly. And I think a lot of our staff and faculty and other members of our community are also traveling internationally to see family that they've been separated from for 2 years or more in some cases. And I know that you guys do such a great job of keeping on top of things because they change quickly. So thank you. I'll turn it back over.
I'll add my thanks also to Judith and Patrick, and challenging times, and your whole group in the International Center and the Provost Office have really risen to the occasion. So on behalf of everybody, thank you so much. And it's not over, but it's changing, and I really appreciate the help, and you're spending some time with us today. I'm going to turn things back over to you, Preeti, to deal with questions that have come in, and we've got a number of them queued up.
Yeah, and thank you. This has been a great discussion. So hopefully Rob is on. I'm going to ask him this first question. Is the university encouraging people to get booster shots? And you have a couple hats in this, and people should know that you are also a very busy, very sought after primary care physician. So people are asking you this question every day, Rob. What do you tell them?
Yeah, well, I think, well, first, thank you for that. The good news is that the supply of vaccine is strong right now. So that's very different than when we were going through the original push. The factors that determine sort of the recommendation for a booster or not is, the first with the vaccine type, and the ones we're talking about is the Johnson & Johnson or the Janssen versus the mRNA. Anyone who's had a Johnson & Johnson vaccine initially in the more than 2 months out should really get a booster shot. That's a strong should, and it could be any of the vaccines. The second has to do with risk categories for the people who got the mRNA vaccine. So if you're 6 months out from your mRNA vaccine, you think about what's your category, and those who really should or anyone who's over 65 or anyone over 50 who's got a health condition. And there's a long list of health conditions that are on that list. But the people who may get a vaccine, and I think this is why it's still, I know a lot of questions in the chat about why aren't we, or are we considering boosters as part of the policy, is that they're not uniformly recommended for everybody right now. And what the CDC currently regards as being fully immunized doesn't include booster shots. And we're going to stay with our policy linked to that designation of what it means to be fully immunized. But the people who may are the people who are younger, but still have some underlying health conditions, or if there is a concern that you either work or live in a higher risk place, like a healthcare worker. I think people who work in education should consider it. And I think certainly people who live in congregate living arrangements should consider getting a booster also.
Yeah, this is something that will continue to change and evolve, and the dosing strategy is different. And the other piece, and we're not going to talk specifically about this, but I think the email will include some links, is that now young children are being vaccinated, and to much joy, the 5 to 11-year-olds, and all of this is going to add to it, and all the boosters are important. And I am fortunate to have gotten mine not that long ago. Same day I got my flu shot, actually. Is that we still need first doses in people. And I think we can't lose track of that. And we're not going to boost our way out of this, but boosters are important. And one thing, Rob, I'll add, because people do ask me as well. And I say, ask Dr. Ernst, but I say that jokingly. But one thing that is a consideration is that people who have vulnerable family members that they are caregivers for, I think this is something that's important. And to me, it's a rationale for making sure that you can stay as safe as possible. And it doesn't negate the need to do these other pieces, but vaccines are certainly the backbone. So thank you. Next question, and this one is for Provost Collins, is can the university reconsider their grading policy and allow for any class to be taken pass fail this semester, even in the major?
So we are not at this point reconsidering the grading policy. When we return to having most classes offered in person in the fall of 2021, we returned to our traditional grading systems and discontinued that option to convert passing grades to a pass. And we also are no longer using the NRC grade, or the no record COVID. So I do want to note that pre-pandemic, there were often requests from students that we have a different type of grading where there were more opportunities to use pass, whether in the major or not. And so in that context, it's not surprising that we are getting some requests for kind of reconsidering the grading policies at this point. And that's been a kind of longstanding conversation. I do want to remind those who are listening that grading policies typically rest at the school and college level. So, of course, I do want to recognize that while most of our classes are back in person, the pandemic does continue, as we've been talking about, and it kind of evolves in different ways. And there is stress and uncertainty that impacts our students. And so as a response to that, we did temporarily extend across all of our schools and colleges for undergraduates a more flexible withdrawal policy that allows students to withdraw from a class at any point up until the last day of that class. So certainly not after a class has ended or after a class has been graded. And in most units, it is true that if you withdraw from a class after the drop add date, that you will get a W on your transcript. But that does, in a sense, empower our students to make a decision about whether they would like to have a grade recorded for the class. And so that added flexibility seemed helpful and important to us. I'll also note that for graduate and professional programs, and this includes the Rackham programs, they also returned to regular grading systems and processes for this fall, and additional flexibility for course selection and withdrawal policies for the graduate and professional programs is determined by the governing faculty for each of those programs. So that's just a kind of high-level summary of where we are in terms of our grading at this point.
Yeah, thanks. And I would just say, just with my mom hat, it's like for students who are really feeling stressed about this, make sure you reach out to your professors, your instructors, and there are ways to get help. It's still November. And I'm thinking especially of the first year students who may especially feel stressed. Thank you.
Absolutely. Yeah.
Rob, I want to bring you back to talk about the COVID-19 dashboard. Why is it only updated Wednesday through Sunday? And there've been a few glitches with some of the data feeds. Can you quickly walk us through that right now?
Yeah, and I know it's frustrating because there have been technical glitches associated with the dashboard. We receive testing data from 6 different feeds. The health service both does testing on site and sends some things over to Michigan Medicine, Occupational Health Services, the CSTP, athletics, and outside testing. So it's a complicated sort of aggregation of test results, and there have been some technical issues in that step. There's also something we've noticed is that because of the wider availability of testing, sometimes people are getting tested more than once. So there has had to be an insertion of a step to try and remove deduplication. So it's been frustrating. So it's multiple streams in. There's some built-in lag time for the the turnaround time to have the tests completed in the first place, and then this deduplication step. So it's really frustrating, and I know colleagues on campus, IT, as well as the health information technology team at Michigan Medicine are working to try and resolve these issues.
Thank you. I'm going to bring on our favorite immunologist to take on the next question. Why is natural immunity being ignored? President Schlissel.
Yeah, it's really not being ignored. It's being studied pretty intensively. And there is data that shows that if you've survived COVID-19 and recovered, you do have a degree of immunity. The question is whether it's better or different than the immunity you get from a vaccination. And that's being studied. Even a couple of weeks ago, the CDC put out some brand new data suggesting that for folks that have either been infected or vaccinated within the last 3 to 6 months, it's actually better to have been vaccinated. The immunity seems to prevent disease 5-fold better, the vaccine. So the jury's still out on which is better in the long term. But for now, we're going to continue to follow CDC guidance that vaccination is what's most effective at preventing new serious infection, preventing hospitalization, and preventing death.
Thank you. And Martino, if I could get you to weigh in, this is a question a lot of people are asking. Updated guidance for student groups that wish to have in-person speakers next semester?
Yes, so student groups are encouraged to have in-person speakers or virtual speakers, with whatever works for the program, but it's best to connect with the Center for Campus Involvement if students need advice on how to plan a program on campus and how to book speakers in alignment with public health guidance. Students should follow the same guidelines that university departments do in terms of masks being required for indoor events, with a few exceptions if the person is speaking or for broadcast or to an audience, maintain 12 feet of social distancing. If a person is when you're actively eating or drinking, obviously it's kind of hard to wear a mask. And if you need to remove the mask for a brief photo, although, you can look great in photos with a mask, that's okay too. So with any of these exceptions, distancing is really important. And then I would also advise students who are planning a program, if they have a guest list, to send the guests the link to Response Blue so people can arrive prepared to show their Response Blue.
I know we're at the end of our time. I don't know if we have time. We've answered this last one a few times, but I'm going to turn it back over to the president, maybe to wrap us up here.
Yeah, thanks very much. And, despite the fact, I think it's important for everyone to realize is despite the fact that vaccinated people can still become infected with COVID, the data is really holding up that they are protected from serious illness, from serious symptoms, but most importantly, from hospitalization and death. So the vaccination, although it doesn't absolutely prevent infection, it certainly is a huge help at preventing serious infection, hospitalization, and death. The breakthrough cases the vaccine works. That's the most important thing we're doing, is the message I'd like to leave. And, in closing, COVID-19 rates really are increasing around the state. And now many states around the country are showing upward drifts in COVID-19 infection rates. So It's the high levels of vaccination that are keeping infections from becoming clusters. But vigilance is still required, as Dr. Malani said. At large social occasions, please wear your mask. Avoid large social occasions unless they're really important. Most infections are still occurring at social events and without masking. Think about your family safety when you travel and convene for Thanksgiving. Take advantage of the free on-campus testing that Drs. Malani and Dr. Martin told you about. Very importantly, if you feel ill, wear a mask, get tested right away, stay away from those you might infect. Be smart to protect yourself and to protect others. If you feel ill, it's more likely influenza than COVID, and that's the way the data is looking now. But look, thanks to all of our guests and visitors for today's session and all of those that submitted questions. We'll go through the online questions we didn't get to and modify our FAQs online to make sure that we've got all those things covered. Have a great upcoming weekend and a wonderful Thanksgiving break. Travel safely and go blue.